last presenter is Peggy Price. She is the director of the Department of Social Services, and she is probably the person that is going to provide the most relevant information that you will need to take with you today. This is where the enrollment is going to happen, and this is probably where everybody will want to call to get at least some direction of what it is they have to do or where they have to go. I will give you her bio. In her role as the director of the Social Services Department, she's responsible for promoting economic, social well-being, and protection of vulnerable individuals in the community. The department employs over 400 staff and administers several programs, including Medi-Cal, CalFresh, temporary assistance to needy families, welfare to work, in-home support services, adult and child protective services. Peggy has been close to 20 years experience with the department and has served in leadership roles for programs in social services and child welfare, adult services, and administration. She is a member of the County Welfare Directors Association and Southern Area Consortium of Human Services. She also serves as a commissioner of the Imperial County Children and Family Services Commission. She is a consultant in training for the Drug Endangered Children Training and Advocacy Center. Since 2008, she has been an instructor for the University of Phoenix School of Business. She holds a Bachelor of Science degree in Business Management and a Master of Public Administration. And I never would have found out anything about the important role that Peggy and the Department of Social Services has in the Affordable Care Act had it not been because Robin directed me to her. So please join me in welcoming Peggy Price. IT.
Okay. Where do you want me to stand? Does it matter?
Close to the screen's good,
Okay.
but not in front.
Where's Selena? So while we're getting ready, listening today, I'll be honest with you, this is the first time some of us have come together for the first time. So it's been interesting to hear what everyone is trying to do for our community, to help people get enrolled and understand what healthcare reform and Affordable Care Act is about. And I think as time goes on, in a relatively short time, we are going to have to work closer together so that we are delivering the same message and we're able to provide the information to people so they know where to go and who to call. And having 211 here, that may be one of our conduits. I don't know, we're going to have to do some talking. But I felt like there sounded like some duplication of services, and I know that we have work well together, and as you know, I hear this from other counties that we talk to when we get out there and we go to conferences and trainings and meetings, that they're really impressed by our ability to work with other agencies. And in working here, and I have almost 20 years with the social services, we've done a tremendous job in doing that because our resources are limited. And we can't get the job done by ourselves. We know that. So we maintain some pretty good working relationships, and through this venue of healthcare reform, hopefully we'll be able to build an even stronger network to help our community. So my presentation, I didn't want to get too technical because you got a lot of technical information, and it's difficult to tell somebody whether or not they're eligible or not because there's a lot of information that is required. You know, what's your income, what type of assets do you have. But what I'd like to do for you today is tell you how we are preparing for healthcare reform as a department, because we are going to be maintaining those caseloads of Medi-Cal cases and CalFresh cases. Louder, she says. Okay. What am I doing? I'm not doing. this is actually a presentation that I gave a few weeks back to the Board of Supervisors. There was a pretty good write-up in the paper with detailed information in there. So I may not go over that completely, but I talk about healthcare reform in our community, our current county operations, what healthcare reform is for social services, and some coordination that's going to happen between Southern California. Okay, so I don't know if you can see these numbers, but what we're anticipating according to the state, Robin mentioned this in the morning, is that there's going to be 20,000 more residents in our county that will be eligible for Medi-Cal. Now, this is a number that's been provided that's over time. It was a 5-year estimate, but now it'll go out, the estimate now goes out to 2014. And we're going to have to take those cases on. Now, again, that number is spread out over 5 years as an estimate. And so what they've asked you to do was to gear up and get ready for them. But one of the things that we've had discussions with other counties is it depends on the behavior in your communities. For example, do they like to have a face-to-face interview, or are they more technically savvy and they want to do everything on the computer or online, or would they rather just call on the phone? For example, a lot of our services that we receive, if you think about it, your cable, your phone, we get on the phone and we can call a call center, or much of the business we can do online. So that's going to depend on the surge, whether it's going to be extremely high or if things are going to trickle in over time. We anticipate that many of our community members are going to want to see someone face-to-face. So that's what we're going with. That's how we're going to plan. They talked about the 400% of the federal poverty level. And so I won't go into this. You've heard this over and over again today. Let's see. At the time, open enrollment does start on October 1st. So people can either call or they can walk into our department and we can do a pre-enrollment. Now they won't be eligible. If they are eligible, they won't be until January 1st, but they can get, a jump on things and come in and apply. Let's see. So this is what it looks like for our department today. We are carrying the cases for Medi-Cal, CalFresh, the CMSP programs, and we do the intake, which is taking in the applications, and then determining eligibility, and if they're eligible, then we carry the ongoing case. We offer multiple channels of services. You can come in person. We are getting better with our technology. You can go online and you can see what we have there. We have some links that are available. You've got some resources today that I think we'll be working closer with, that we'll add those to our website as well. You can apply over the phone and you can apply by mail. But one of the things, the reason why I have this information up is so I could present it to those that weren't familiar with our department. But we do have a lot of trained staff. We have, we have about 73 staff that handle, I think we have about 50,000 cases right now. Combination of Medi-Cal, CMSP, and CalFresh. So it's a lot. It's a lot if you think about it with that number of staff. But we get it done. We're not, there's areas where we can do better, and we're working on that, but we do the best we can with the amount of staff we have. What else? We have staff out in the community. Some of you are aware of that. Some of them are housed with you. In fact, I was wondering I think I asked Sylvia before I came so I could gear my presentation for the audience, but it seems like we really have a blend of folks that are here. So with that said, but I do know there's some agencies here that we have staff co-located with you to assist with helping people enroll in Medi-Cal and being there to answer questions, take documents. So we have staff that goes out to the outlying areas, Salton City, Nyland, Ocotillo, you know, wherever the need is. So our main office is in El Centro, but we have full operations up in Raleigh. We have staff down in Calexico, and then we are out in the schools and the resource centers and Clinica. I spoke with somebody from Clinica, and then there's others of you that are here that work very closely with a team of staff to help with the Medi-Cal applications. Also for our department, we do have experience of going through some major changes. So, you know, we're doing our best we can to learn as equal arts, because this is happening rather quickly, and the information doesn't seem to be coming out fast enough for us. So we've gone through transitions such as welfare to work, the under welfare reform, and then somebody talked about Cal Fresh, and also just having the experience of carrying thousands of caseloads. Big for our department. This is a culture change in some ways for us, because the state is telling us, look, you need to act more like a private industry. They shouldn't take as long as it does to get things done. So, you know, in my discussions with our staff, we have some great staff, you know, they have different skill sets. And some of them are kind of what we call old school, and they really feel like a gatekeeper. You know, I got to really protect the taxpayers' money, and you know, I'm gonna, you know, make all the efforts that I can to make sure that you know, there's no fraud happening here and that sort of thing. And those are the ones that we're really working with to say, we get that. We want you to do that, but at the same time, people, if they're eligible, they're eligible. Let's get them enrolled. Let's be timely about it. Let's treat people, you know, with the best customer service that we can.
On that note, is there going to be, with the expansion on Medi-Cal, some adjustments on the criteria for eligibility, I understand?
Yes. And,
Could you just really briefly?
Well, Sylvia's giving me the
Yeah, we're gonna have a Q&A right after Peggy's
Oh,
done.
I'm sorry.
So that we can, but write your questions down, please, so you don't forget.
That was it.
Yeah, and that's part of the message that we're giving to our staff too about customer service, is that even the state is saying and the feds are saying, we're gonna loosen things up. You know, we're not gonna require as much information. We still want you to do your job. We still want you to detect fraud. We still want you to, you know, protect taxpayers' dollars, but at the same time, we want to help people get enrolled and help people that really do need these services. So that's big for us. We're really, sounds like a fundamental thing, it should be, but you know, you have experienced some, you know, poor customer service, I'm sure, and so we're really working in that area. We are, what else? I talked a little bit about this. Oh, we are hiring some new staff, not a lot, but we are gonna get some additional staff. We're also really assessing each department and how efficiently we're using our business processes, and I'm shifting staff around where I can if we can better utilize them somewhere else. Training, we're doing a lot of training right now. I've asked for, some people want to come give presentations, but right now we're inundating our staff with training, and then they're having to work their caseload. So we appreciate that. We do want you there, but right now we're doing a lot of training. We're trying to increase our use of technology. If you've looked at our website, we've already made some changes. We have a person in that office that she's young. She has a lot of computer and technology experience. That's where she has a degree in. So we've got her in there and really trying to, if you look at other counties, they use their website as a tool that we haven't before. So we're building that up. We want to provide videos that are available for folks that, you know, that they can watch the videos online instead of having to come to our office and watch these videos on rights and responsibilities. If there's a court process, we want to explain the court process for some of our other programs. So we're really trying to increase our use of technology. We're trying to make our facility more customer focused. If you've ever been to, how many people have ever been to our department with a client or come in to our main lobby for intake for a Medi-Cal application. The lobby's not very big, okay? So what I wanted to do, I've been wanting to do for years, and now I have that opportunity. I'm shifting that down to what we call the big CalWorks building down just at the other end of the parking lot. It's got a much larger lobby, and so better to utilize larger crowds of people, and we have more interview rooms there. They're more private. The way that building was, it was built later, whereas the buildings that we're using now, we've sort of added space in where we could, so you don't have as much efficient use of the building. We're implementing policies and like I said, business process changes, and we're trying to respond to all this information that's coming out. And I was talking to some staff yesterday, and they were telling me that they had a 5-day training that they were able to pare down to 1 to 2 days training, because that's huge when you have a caseload and you're trying to get your staff trained. So we're trying to be as efficient as we can, but yet get as much information out there as possible to our staff so that they're prepared. I just gave a real brief flow chart of how this is going to happen. It seems a bit confusing, and so just in general, what's going to happen for Imperial County is that anyone that wants information about Medi-Cal can call. There's going to be an 800 number available, okay, and that's on the top line there. And they're going to filter the call. They're going to, they have a hub, a database that will check their information that they provide, their income, and things like that, and it's tied into, your IRS, so your income they can check. And then based on that information that you provide, they're going to send you to different providers. So for us, if it's for Medi-Cal, it's going to come down to a call center out of Riverside, California. They're going to take our calls, and they're going to they'll be able to input the information into the application. So they'll do like a pre-enrollment for you, and then that information goes into our system, and then what they'll do is set up an appointment for you to come in and see us and bring the documents that you need. So in the sense of answering the question in the back there, the state is trying to ease up a little bit on the requirements, so you can do a lot of that just over the phone based on some of the information that they're able to get from this hub of information and get you enrolled, okay? So, I know it's very basic, but a lot of people want to know how's the flow going to work. So just in a nutshell, that's kind of how it is. So I know that as we work together closer with the agencies that have presented today, 211 might be in there somewhere too. So, this is what Medi-Cal, they call it Medicaid, right? But California is Medi-Cal. The eligibility was just elderly and disabled children and pregnant women, typically. And now that umbrella is going to cover everyone that is eligible according to your income and your assets. So that'll include adults who weren't necessarily eligible in the past. We had programs for children, but not their parents because of their income. So that will encompass more of our community that needs the health care and primary care, like what the doctors and public health, Robin Hodgkin talked about this morning. We really want people to get out there and get the primary care so that they're not waiting and then going to the hospital when it becomes an emergency. So I know you probably have a lot of questions for us. I really want to keep it short and give us more time for questions. So is that where we're at now?
Yes.
Or can I take some? Or?
Well, we're going to put your chairs up here in front for the 4 speakers.
I would like just to offer for the people that is present that the Healthcare Healthcare Memorial District have offices in Calexico, 601 Heber Avenue, and is willing to accept any speaker or person that is willing to go and provide information to our community. We are offering our offices. So any contact, my name is Norma Podaca, the president of the board, and more than welcome to help.
I think what's gonna, thank you, I think what's gonna come out of this today, and I know we're designing a outreach plan that our department is going to contact many of you out there. Our department also uses, is Amanda here? Amanda from County Office of Education?
I think she left. She
Okay,
has to leave.
but we have different networks of people, and I think that what we need to do is filter and schedule for the particular audiences that are wanting a presentation out there. I hope that we can do that today.